The topic today is popularity of genetic tests and understanding diagnostic and carrier testing. I think most of us understand gee, why does it work on this person and why doesn't it work on that person, and all the different variables within each individual, and all that has to do with the genetic testing and all the genetic differences between us, of course. And so it's exciting that this is now really getting more and more mainstream within medicine, so that it's a more of a personalized solution and customization. So very excited to hear more of Dr. Deborah Harding and the Harding Health Institute to explain why it's important for both physicians and patients, and explain in great deal about the various different popular tests that are out there and how it impacts both the patient's outcomes as well as just, you know, I'm sure it excites physicians when it works. I would imagine. Anyway, so a little bit about Dr. Deborah Harding. She is well, first of all, she's been practicing medicine for 3 decades, which I was like, really? You must have started when you were, you know, like Doogie Howser, 12 years old or something. But she is the founder and CEO of the prestigious Harding Medical Institute and its subsidiary Harding Anti-Aging Center. As an expert in the field of anti-aging medicine, Dr. Harding is board certified in internal medicine, certified by the American Academy of Anti-Aging Medicine, certified by the American Academy of Sleep Medicine, and also, I should have double checked on this pronunciation of the Cenegenics, certified in age management medicine. She is a graduate of the University of Virginia and the Southern Illinois University School of Medicine. Dr. Harding is a nationally acclaimed speaker and educator. She also proudly serves as a faculty member at the UCF Florida Medical School. Furthermore, she's a member of the Life Extension Foundation Scientific Advisory Board. So she's got lots of credentials behind her. We're so proud that she could be here. And she also brought her husband, Dr. Victor Harding, who also works in the Harding Institute as well. So give a round, warm welcome to Dr. Deborah Harding.
Thank you, thank you, thank you. Good morning, good morning. It's such a pleasure to be here today. I'm very excited. Thanks for everybody for working so hard to get me here. Connie, thank you, and obviously all the teams. I'm going to be talking about a really awesome topic today, something that's dear to my heart and something that's changed how I practice medicine on a daily basis. I thought it was fun, since we were waking up early this morning to get here, that we would call it the dawn of a genomic precision medicine, because that's what we are dealing with. It is the dawn. Genetic medicine is going to be the ultimate prescription for staying young. So I want you to imagine for a second, imagine reaching the age of 100 but feeling like you are 50. The time really is now. Medicine has changed so dramatically in the last 50 years. Actually, every year it's moving so quickly. So the science and technology now exists that we can actually prevent the leading causes of most diseases years before they even present. Genetic medicine is what's going to be the new dawn. Genetic medicine is going to be a change. It's a game changer. You're going to help you to regain your health, enjoy your life to the fullest, slow down the aging process, but more importantly, allow us to prevent and reverse major diseases. All these diseases that we see here, heart disease, hormones, Alzheimer's, these hopefully in the future will be diseases of the past, diseases that we don't have to deal with. But we'll just have to wait and see, because it's changing. The new strategies we're going to be talking about for preventing premature aging, preventing premature diseases. Genetic tests are at the top of this list right now, because that's what we're going to be talking about. But everything below there, from telomeres to inflammation to blood glucose, those are the things that I work on a daily basis with my patients to really change the way they age, change the way they feel, change the way they interact with life. So, but today we're going to focus in on genetics and how it's going to impact your life. So we're looking at healthy from the inside out. We're going to really go down to a molecular level today. 80-year-old, this is awesome. This is not my car. I wish it was my car. It's an 80-year-old Bugatti worth millions of dollars. And if you can start maintaining yourself like this car, you're going to reap the benefits. As my mother says, she's 98, she's still actually functioning and going to work, which is incredible. Your health is your wealth. If you don't have your health, what do you have? So you can have as much money as you want, but if you don't have your health, you're really, you're really in a bind. So start focusing and thinking on how you can maintain that health. Living healthier really starts with learning more about your DNA. So you discover yourself. You're going to discover things about yourself that you never knew exist. Precision medicine, a full DNA sequencing. It just seems to me just so impossible that we can actually do this. Something that was costing millions of dollars has now come down to the thousands and now even the hundreds of dollars, and it's keep getting cheaper and cheaper and cheaper to do this. Precision medicine means that we'll use your DNA to focus in on how we can keep you as healthy as possible. I'm going to take you back to class for a second. I thought I better bring you into what this is all about so you can have a little bit better understanding. So here we are, back to basics. You have 23 chromosomes. We all have 23 chromosomes, and that's what they look like when they showed it to you in science class. They're actually numbered by size, largest to smallest. And inside each chromosome are these things called genes. If you unravel that DNA, it actually can go for miles. And it's, every person has 2 copies of the genes, all right? And these genes can vary from something that's as small as 100 base pairs to 1,000,000 base pairs. Think of it, these are the genes that make the proteins in our body. This is what tells our body how to function. So an example of a gene, let's say I'm going to go make pasta tonight. If I'm going to make pasta with butter sauce, the recipe's really small. If I'm going to make pasta bolognese, it's a very long recipe. So think of that's a good analogy to kind of give you an example of how these genes work. Looking in deeper, all right? We're looking at the DNA. You see, let me see here. You see adenine, thymine, guanine, cytosine. This is the code. This is the hereditary material. How that code is aligned, A to T, G to T, that is what actually, it's like Morse code. It tells the body how we make this protein. It tells the body, how we do all this sort of stuff. So it's the order of these pairs that gives the instructions to the body on what to do. Here's an example of a chromosome number 17. And right there, that's home of the BRCA gene. All these are all the different genes there. BRCA gene is what is associated with breast cancer. So now we know when we look at different genes what disease or what preventive thing that's on a gene. All genes are bad. I mean, there are things on there that do extremely good things for us, where they're located. And as we're now able to map these genes, we know more and more. We have about 22,000 genes. We know about what a quarter of them do right now. This is what they really look like. Your chromosomes in a little ball. That's really a 3D picture of what they look like. I showed you the basic picture, but that's really what it's all about. Every color there is a different chromosome, our 22 chromosomes. All right, if a protein messes up, well, it's going to throw that entire system off board. So man, this is our highways, the highways and byways of how things are working. So if you have a problem with the protein, you can see it really can mess things up. So genomic precision medicine is really going to transform how people stay healthy. Many predict, I predict, that by 2020, 20% of Americans will know their DNA. And people are going to use this DNA to optimize their health and their wellness. And then they're going to take this powerful computer technology to prioritize what's more important, and then couple that with steps towards reduction of disease, preventing disease, becoming healthier. People are going to no longer react to symptoms. We're going to be proactive. We're going to know where we stand and what we need to do. So what can you actually learn from your DNA? Well, there's lots of different types of sequences. The first one is called genotyping. That's just looking at little pieces. That's kind of like a 23andMe, knowing all right, what color your hair can be, where's your ancestors, little things. Then we can focus in on something called gene panels. This is getting more complicated. This is where we're looking at different diseases. For instance, we know these genes particularly cause a certain type of cancer, or this is what's related to Alzheimer's. This is what's related to heart disease. This is what's related to diabetes. So we can actually focus in on different genes. And then the latest, which is really incredible to me, is now sequencing all 22,000 genes. You know every single gene that you have, and then as the research comes in, we're actually focusing and learning. Every day there's something coming out that this gene's done. It changes. We may think one day that this gene does this, and a little bit later on say, wow, it really does something else. There's lots of companies. I'm not associated really with any of these companies, but I think every single day there's somebody new coming onto the horizon that are going to be bringing in different types of tests, different ways of looking at it. There are different levels of testing, all right? Some people want to know everything. They want to know, am I a risk for disease, even if there's nothing you can do it. Some people say, I don't want to know the things that we can't treat. For instance, Alzheimer's, ALS, Parkinson's, although now we're getting more and more treatments for Parkinson's. Say, I don't want to know that. So they don't open that portal. The other people want to know only things that are treatable, things that I can actually make a difference. But if I'm at risk for heart disease, I'm going to be proactive. What can I do to make that heart disease not happen, or different types of cancers, or different things with their children? It's going to make a big difference in our families. Comfortable and fun, those are great. What kind of athlete are you? Are you somebody who's better at sprinting? Are you somebody who's maybe a long distance runner? What diet is best for you? What supplements are best for you? All this stuff is in our DNA. It's really us. So what do you get? And every different type of company gives you different things. I mean, normally you're going to get, a level that will show you the testing that you did. Auto-updating is new. That's where the companies are now saying, we have your genetic data, and you pay a small fee, and as new things come out that apply to you, you get that information. I'm seeing that now in my practice because we do genetic testing. And again, you decide how much of the portal you want to see. You decide who you want to share the portal with. In some of the more sophisticated testing, I actually receive the data first, and I analyze it, and then I release it to the patient, and then we sit down and we make changes. We actually make a whole roadmap of what we're going to do to make that person as healthy as possible. What's a gene mutation? All right, here we go. We have this code, CAT, 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 and then here's the mutation right there. Instead of the A, you got a C. Well, what that does, it makes a different protein. It may make the protein better. For instance, people have one copy of the sickle cell gene that gives them protection against malaria, or it may make something not work, which is more serious. In this example right here, another nucleotide was changed, and that's going to change what kind of protein that you get, and the protein just stops. It didn't make the entire protein. So you saw from that slide how that can really wreak a lot of havoc in the whole system. Cancer. What's cancer mutation all about? Let's take it here. Step one, there's your DNA. DNA damage is caused by heat, radiation, chemicals, anything that attacks our DNA. Well, our DNA is constantly being attacked by things in our environment, and that's why it's so important. It's probably the number one thing you want to protect. So normally you have this thing called P53. It's a suppressor gene. If there's a cancer cell, bad cell is made, P53 comes in and repairs it. And then what it does, it repairs, so we only start getting good cells, and the bad cells are thrown away. So we no longer have cancer. We are actually making cancer cells quite frequently. And thank goodness our immune system and our body is getting rid of these things. In this example, DNA is damaged, P53 is not working, P53 fails to stop cell division, and that's what leads to cancer. So that's one of the ways that cancer occurs. There's other ways that it happens, but that is one of the more frequent ways. All right, these are the things that can attack your DNA. About 75% of a person's health is dependent upon what damage has occurred to their DNA, not the DNA itself. That's why we're always talking about healthy lifestyle, lowering inflammation, eating more organic, protecting that DNA, protecting the code that's going to make a difference in how we function. So personal genetic analysis really is smart prevention. I've been using genetic medicine for, oh my gosh, I think a long time, longer than 10 years, for things like lipo-E genetics, so predicting heart disease. If somebody has something called higher ApoE4, I know that that patient is more at risk for heart disease and diabetes, so I'm going to treat that person more aggressively just to lower that risk. Colon surgery, you can look for colon cancer risk. Aspirin. Nobody in my practice takes the same dose. We actually can use their genetics to predict and say this is the best dose of aspirin for you. Blood clots. Some people are genetically more prone to blood clots. If we put them on some drugs, I need to know that before I treat somebody. For instance, if we're doing hormones and different things. So that's just a little taste of what this smart prevention is all about. And obviously, cancer's right up there. So it's how to transform yourself into the best health of your life using the latest technology. That's, if I can stress anything to you, it's learn about this technology, but more importantly, incorporate it into your health plan so that you can take advantage of this stuff that is just absolutely incredible. So it will reveal what health issues you're prone to. Prevent future diseases, so you're proactive. You don't have to wait for the disease. Discover which medications actually work the best for you. You don't have to take a medication if you know you're already genetically prone to have a problem with that. And optimize your diet and your exercise by finding out what works best for you. These are some things that genomics reveals, this whole thing of looking at your DNA. Pharmacogenetics, these things right here are all ways that we process, different channels that process different diseases. Everybody, some people process drugs fast. Some people process them slower. That is going to change the dosing. Risk of disease, we've been talking about that. Your cancer, your heart attacks, your diabetes. Answer questions. Some people don't know their family history. They're adopted. Or they do know their family history, and they go, a patient, my family, my dad, my mom, had this particular type of cancer. Am I at risk for that? I just had a patient who did have his family history of a thyroid cancer and found that actually carried the gene. So what do? We're proactive. We're doing more ultrasounds to make sure that we pick up something a lot earlier. Carrier status for recessive genes. To pass a disease on to your children, you normally knew if it's a recessive disease, you need 2 copies. We're now doing pre-pregnancy planning to see if people carry a gene so they can actually prevent from having a problem. A diet and exercise and ancestry. That's fun. Where you come, where you're from. I find that really exciting. So one thing to know is no one's DNA is perfect. Every person in this room has a mutation that either influences disease risk or maybe something that actually makes you healthier. So all of our DNA can be very, very different. But the thing to know is nobody has perfect DNA. I wish. So the question you can ask yourself is, am I at risk of a serious medical condition? Is there something in my genetic makeup that puts me more at risk for Alzheimer's or premature aging or heart disease or diabetes? Because if you knew that, I think you would change what you do. You're going to act now to prevent disease from coming. For instance, additional prevention, preventive screen, lifestyle changes. If you know you're prone for heart disease, you can probably change your diet or exercise. Preventive surgery. Women who carry the BRCA gene, 1 or 2, a lot of women are now making the decision once they've had their children to go ahead and preemptively, have their breasts removed, have their ovaries removed, and essentially, hopefully, remove the chances of them developing a very serious disease. I just went through this with one of my friends. And you know, it's a big decision. But when you know that you can actually prevent and lose, you know, the fear of getting that disease, it's very, very powerful. Natural supplements and medications. There are a lot of things out there that can affect how your genes function, make them perform better. And then the coolest thing is gene editing. We're going to be fixing genes. We're doing it right now. So here's some things. Discover which medications are the safest and the best for you, even before you take them. I have a program now, when somebody's done full genetic mapping, I can actually put the drug in, and I'll show you examples of that. Will tell me, for instance, which drug is best for psychiatric medications, for depression. They're red, yellow, green. Red means that one's not really going to work. Yellow means I kind of have to adjust the dose. Green is good to go. So those are some of the things that we can see. Learn how you can tailor your diet and your lifestyle and your exercise to optimize your health. Some people are better runners. Some people are better long-distance runners, sprinters. Some people, caffeine is good. Some people, caffeine's bad. Some people, alcohol will be good for your cholesterol. Some people it won't. So it really, really changes when you look at it from this way. So you can see that it can be really life-changing, not only for you, but for your family. It's powerful and it's really insightful. It really changes. Can you see how it changes how you really look at you? How you're used to going to the doctor and doing the routine blood test. But this is like the next level where you can actually know your future. You can actually focus in. So here's an example. Breast, ovarian, prostate, pancreatic cancer. We know that the BRCA1 and BRCA2 are sometimes defective genes. Those are the genes, the suppressor genes. They're supposed to, if you make a bad cell, make them go away. So that's how this cancer a lot of times forms. We're now able to measure over 1,000 suppressor genes. You can know if you have a problem with one of those genes. This is a company. I couldn't put it all up on the slide. They check approximately 98 genes to tell you if you're at risk for about 25 to 30 cancers. One single test. Very affordable test. Risk of disease. Here's some interesting things. For instance, we have cancer, we have accelerated heart disease, which we've talked about. Macular degeneration, very, very common in the population. I see this coming up pretty commonly. There are supplements that will slow down the expression of macular degeneration, even maybe prevent it. That's something that affects the eyes. Alpha-1 antitrypsin deficiency. That's a problem in the lung, more risk of getting emphysema and chronic bronchitis. If you had that, you wouldn't want to smoke. Celiac. Oh, the one at the bottom, hemochromatosis. I use that all the time in my practice. What that is, it's a genetic mutation where you actually can't excrete iron. What happens is the iron builds up in the liver, causes liver disease. Guess what? The treatment is donating blood. Disease is removed. How awesome is that? And actually, we do that quite a bit. So late onset Alzheimer's disease, we now are looking at the genes for that. And let's go into it right now as we got it. So ApoE is a major genetic risk factor for Alzheimer's disease. We actually started testing it when we were looking at heart disease. A long time ago, it's like, we don't want to know that, or, there's nothing you can do, so why know it? Fast forward, and now the treatments are getting so much better, and there are things that you can do based on your genes. For instance, if you're ApoE positive, the Mediterranean diet has been shown to reduce the risk of Alzheimer's disease if you're ApoE positive. One serving of seafood lowers your risk. Well, who's not going to go get some fish in your diet? Black or green tea. Change from a coffee drinker to a tea drinker because that helps based on your genetics. And this is exploding. In Orlando, I just had a conversation with one of my neurologists. There's a huge study coming right now looking at if you're ApoE positive, 2 copies or even 1 copy, where they're going to be doing a medication trial to long-term to possibly prevent Alzheimer's disease. So if you've never tested for that gene, you can never take advantage of that. You just kind of go along your way like we're used to going along. You know, it's just going to happen. Well, it doesn't have to happen. So, and then we've got new promising diabetic medications that actually can change what happens in this disease. Breast cancer. Did you know that women who are positive for the gene can reduce their risk of breast cancer? Well, you can commonly think, well, yeah, you're going to do more screening. And I'm actually going to say one thing, that men are actually who carry this gene, they're more at risk for prostate cancer. That if you consume more caffeine, it lowers your risk. You participate in a sport, it lowers your risk if you have the gene. And obviously, you can opt for removing the breasts and the ovaries. And also, we now know if you carry this gene, we're finding that some of these genes interact with one another. And for instance, in this case, you may be at more risk for pancreatic cancer. Male patients who carry this gene are at risk for prostate cancer. So it's an interesting thing that you can look at that and make changes. You know, if somebody in your family had prostate cancer, you might want to look to see, you know, if you have women in the family, are they at risk for, you know, breast cancer? So this stuff is crossing back and forth. Pharmacogenetics and cancer treatment. Based on how you metabolize drugs, we can make a change. So we know that patients who have the genes, some of them may respond better to some of the platinum drugs, especially those with pancreatic cancer. This is interesting. Alpha-1 antitrypsin deficiency, somewhat common. And if you knew you carried this gene, which puts you at increased risk for bronchitis and emphysema, if you're a smoker and you carry this gene, the odds are that this disease is going to express itself in the 40s or 50s. If you are not a smoker, you can extend that out to the 60s or maybe not even get the disease. So I would hope if somebody knew that they carried, you know, this genetic problem, that they would change what they're doing. This is one of my patients looking at pharmacogenetics. Patient had heart disease. We're putting them on cholesterol medication. Found that they had one of the genes that made, if I gave them Zocor, which is a common cholesterol medication, they were more at risk of having a side effect to that particular medication. Well, Coumadin, this patient also had this particular way that they metabolize the drug. I knew that, okay, good starting dose is between 5 and 7 milligrams. I still have to monitor them. And the patient did not have hepatitis, but if I did need to treat them for that, then interferon actually was a good choice. So you know, in the future, or not the future, now, when somebody's done this testing, we can actually pop the medications in. And for psychiatric medications, I mean, they're all there. Just kind of put them in and we know how to use it. So you can see it's really more precise. It's not a guessing game. Somebody in the past came in, wants to go, has high cholesterol, just pick one. Well, now we pick it with a strong pinpoint of knowing what's better. Carrier status for family planning. This is huge, all right? You may carry one copy of a gene. If you happen to have a partner and that partner carries that gene, that means you get 2 copies in a recessive disease. You can pass that disease on to your offspring. Well, now more and more couples, before they even consider conceiving a child, are doing pre-pregnancy genetic testing. It's very, very common. We've done it, you know, my daughter has done it. I mean, it was one of those things like, you guys get this testing done. Common carrier genes, you know, sickle cell anemia, muscular dystrophy, polycystic kidney disease, that's a very common one. Huntington's, blood disorders. There's over, just even in 23andMe, they're checking 40 carrier genes. So, you know, it's a very inexpensive, you know, I think for that they're charging $150. I mean, who wouldn't want to do that? Pre-implantation genetic diagnosis, like we're talking about, but also genetic screening. It's normally performed in conjunction with in vitro fertilization. It's really to reduce the risk of a chromosomal abnormality. It increases the couple's chances of having a very, very healthy baby, successful pregnancy. And then more importantly, it reduces the risk of having disease. If you know you have a certain serious disease in your family, you can make the choice. And the way they do it, actually, when we do IVF, you make a whole bunch of embryos. The embryo gets up to 8 cells. We take 1 cell out. We analyze it. Everybody, even in the natural world, you know, you hear people having miscarriages because there was a genetic abnormality. So what they do is they just grade the eggs, A to F. The ones that are F, you don't implant. So you would implant an embryo that has more success of a successful pregnancy, but more importantly, not carrying a very serious disease. Diet, exercise, and lifestyle. These are different genes that, you know, CLDN respond well to exercise. You have that, you're lucky. You respond well to exercise. You know, CSK, fish oil, is going to improve your blood pressure. You have high blood pressure, you don't want to go on a blood pressure medication, you want to try to prevent that, and you have that genetics, well, why not start fish oils? Or maybe that allows you to use less medication. You know, different genes and specialty diets. I mean, it just goes on. You know, here's the first one, caffeine affects hypertension and your heart disease. Somebody has dietary fat, affects their weight or their body mass index. The last one, MC4, are more chances of obesity and diabetes, but then you use that data, look at the other things in lifestyle of how you can actually suppress that gene. So diets and recommendations in the future are going to be based on your DNA. It's not going to like, I think I'll do paleo, or maybe I'll do ketogenic, or maybe I'll do Mediterranean. We can actually look, we're doing it now, to say this diet probably would work better for you. It's not going to be a guessing game. You know, diet and increased risk. Some people, what they eat because of their genetics puts them at increased risk. For instance, the top one, well-done meat, increases in some people the risk of colon cancer. Some people are drinking wine because they say it's going to reduce their risk of heart disease, or maybe they're drinking red wine. But actually, some people, it's not going to make a difference. So drink what you want to do. You know, soy reduces gastric cancer. I mean, it's really fun seeing this stuff. I can tell somebody, you know, you really might want to eat a little bit more soy, put a little bit more soy in your diet because it's going to lower your risk of GI cancer. Special cases, this is interesting. Sometimes in medicine, somebody will have symptoms or things going on. We don't know what it is. Oh, we're like, you know, you have this thing going on, we don't know. And then now what we can do is genetic testing and actually maybe find out what the problem is. I do have a patient, my first one, really did not know what the problem was, did the genetic testing, and it popped out at the top what the reason was that this patient was having symptoms. So it's kind of interesting. Exercise. Some people are better at running. Some people are better at, you know, going fast. Some people are better at slow. What's the best exercise for you? Some people will say aerobic exercise may be more or less likely to improve your blood sugars or your cholesterol. We can now know that from your genetics. This person here has one copy of this gene that if they that will make exercises do not increase their HDL as well. Well, HDL is your healthy cholesterol. So if I know that from the get-go, I'm not going to sit there and tell them to exercise and exercise and exercise. I'm going to look at other ways, other medications, other anything to raise that HDL cholesterol. This patient has 2 copies of that particular genes right there. They all have long names, so you know, you just kind of look it up and see what it is. But this person is better at long-distance running. Think of your kids. They're looking at what sport are you going to put them in. Are you going to put them in, if they're better at long-distance running, are we going to put them in, you know, a sprinting sport, or are we going to put them in something that's long distance? Or if you're trying to improve your health, you're better at long-distance running. This person has at least one copy of these 2 genes. You know, this person, if they go and exercise, they're quickly going to excel because they have the ability to process oxygen really well. So they're great at any type of exercises fast, you know, tennis, running, you know, anything, biking, things that they can really get up and go. What's the next horizon of genomic precision medicine? Where are we going with this? Gene editing. We're going to be able to avoid, prevent, and treat diseases, especially the genetic diseases of aging. For instance, we could modify a gene that's associated with increased risk of disease. Repair a damaged gene. Wouldn't it be awesome if we can repair some of those genes that are supposed to eliminate the cancer if there was a defect there? Modify poor stem cells or other tissues. We can take skin cells now and reverse them back to stem cells. Stem cells are what can go and become really any cell in your body. Graft versus host. When somebody has to have an organ transplant, they have to take a lot of medications normally to prevent rejecting of the organ. With genetic editing, we're going to remove that risk. So think of how that's going to open up if somebody needs a new organ, what we can do with that. And also repair shortened telomeres so that the old stem cells, the white cells, our immune system, continue to function at the best rate that they're supposed to be. Papers are going through the roof. Every single day, you'll see there's a new paper coming out on this gene does that, do that to modify this. And it's because we have this incredible computer technology that this thing is moving so quickly. We now have robots that can do all the genetic testing. That's one of the things that made it so much more affordable. Artificial intelligence, and more importantly, researchers are really sharing this information. We want to get this information out as much as possible. Genetically altered immune cells to eliminate cancer. Cancer cells are interesting. They hide. Your body doesn't recognize them usually as foreign. That's why they continue to divide. So this is an example. This occurred in London recently. There was a 2-year-old patient who had leukemia. What they did is they took her cells out. They altered the killer cells so that, and then they put them back in. So all of a sudden, her own immune system could recognize the cancer cells and eliminate it. It's a war in our bodies. And I just find that, to me, so remarkable. Hot off, this is very interesting. This just happened. Novartis, well known. This, what was this? October of 2017. That tells you how this is moving. The FDA approves genetically engineered immune cells for leukemia and lymphoma patients. Novartis, CAR T cells, just came out. And when I see how this is working, I'm just so excited. These are some of the human gene editing studies. Every little square there is somebody who is right now entered into a study looking at all sorts of different types of cancers or problems. China is rocking on this right now, and you can imagine that they can because they don't have as much of the restrictions that we have here in the States, but we are doing stuff here in the United States. So I think this is just going to get better and better. Business of genetics, going to be a huge business. Things to treat cancers, other diseases, slow down the aging process. This is going to be a multi-trillion-dollar industry, and there's a lot of funding, a lot of money pouring into this right now, which is fabulous for us. This is hot off the press. This is from Northwestern University in Japan, November 2017. I'm an anti-aging doctor. I don't want to ever grow up. I want to be 22 forever, so anything is out there that's going to keep me there, I'm going to take advantage of. Researchers found a mutated anti-aging gene in the Amish community called SERPING1. It extends their lifespan by 10%. It's interesting, if they have a double copy of the gene, their lifespan can be shortened because increased risk of bleeding disorders. One copy is protective. All right, so this gene significantly lowered heart disease, diabetes, slowed down the aging process. They're right now phase 2. That means they've gone to the second level where they actually have a medication that mimics what that gene does. So think of this, gene mimickers to extend healthy lifespan. As soon as I figure out what that drug is, I'll let you guys know. So keep in touch with me. I kind of know what it is, but I want to make sure. So people age because their immune cells lose the ability to continue to divide because of the thing called telomeres. So on the end of those chromosomes, there's these little protective end plates called telomeres. As you age, they get shorter and shorter. When you get down to 0, those chromosomes, the DNA unravels, and you can no longer make a healthy cell. This is something that we all know. We only have so many cell divisions, and then, I'm sorry guys, it stops. Well, now with gene editing, especially of your immune cell line, immune cells are important. Older people more prone to illnesses, more prone to cancers, more prone to the diseases of aging. If you can keep those immune cells functioning, that's significantly going to extend human lifespan, healthy lifespan. So protect your DNA from mutations. You can test your DNA. DNA is going to be changing because we're constantly in our world being bombarded. Our DNA is being damaged. Healthy cells equal healthy body. The micronutrients of all our bodies are different from 20 to 30 to 40 to 50 to 60. So look at what you need and measure those nutrients. Use the new science and technology that you can measure things like vitamin D, B12, fish oils. We've been doing this forever and a day, at least in my practice with the more advanced testing, we've been doing this, but measure those. Eat the rainbow. Antioxidants, lower inflammation in your body. All these different colors from the plant world protect your DNA. Magnify your vitamins and supplements. Don't just take something cause. Take something that you've measured the level is. For instance, fish oil. We measure that. We can tell if taking too much or too little. Optimal medical weight loss. As I said, in the future, it's going to be based on what your DNA shows. Magnify your moves. You really want to move. Don't be a couch potato. When you are moving and you're active, you're sending the message to your DNA, to your cells, that you're supposed to be here. Magnify your sleep. We all seem to want to cut it short. A lot of our hormones, a lot of the things that happen that protect our body occur while we sleep. Magnify your diet, hopefully, and more in the future with personalized DNA nutrition. Magnify your physical. Seek out physicians who are using more advanced technical blood work to keep you as healthy as possible. Remember that your health is your wealth. Spend a little bit of money because it's going to pay off in the long run. Bioinsurance, stem cell banking. If you have any children who are having babies, have them bank their cord blood. For them, for their children, possibly for you. Our fat cells are packed, believe it or not, with stem cells. You can take your own fat, extract the stem cells, store them for a later day. In the future, we know that if we give old rats young blood, the older rats get younger. So just think if you had your stem cells, when you're 80 and you put them in from when you were hopefully as young as possible, what that would do for you. Telomeres, they're the biological clock of aging. You can measure those now. The longer they are, the healthier. You can take things to extend your telomeres. Those are those little yellow things on the end. Very, very important. So the time is now to magnify your life, magnify your health, magnify your future. Let's all get healthy from the inside out, make it lifelong. And I hope I've taught you a little bit. The Genomic Alliance is something I'm a member of. You might want to think about looking into that. These are a lot of doctors. Everybody's looking at genetics. It's a great site if you want to go back to Genetics 101. And if you have any questions, I'm happy to answer them.
Let's give a round of applause for her. What an awesome presentation. Very eye-opening indeed. We have lots of questions. Make sure that you wait to get the microphone so that we've got it recorded. And I'll start over here on this side of the room with Jennifer.
Thank you, Dr. Harding. That was wonderful. I appreciate the presentation very much. I have a couple of questions, actually. I deal with seniors, Premier Senior Consultants. Our specialty is helping families with that next step. with family members, whether it's assisted living or memory care. So I saw on there that you had the slide, it looked like a Christmas tree, that you can know everything that a lot of people don't want to know.
Correct.
So a lot of times we get families that are in crisis because they did not plan, whether it's financial or what are we, you know, where does mom want to go? And Alzheimer's and dementia is not something you know that you're getting. If you say, I think I'm getting it, then you don't have it. It's normal aging, right?
Right.
So I'm always amused by that. And but I think that it would be wonderful if we did know. It's a hard thing to know, but then you would be able to plan what you want, where you want to go, because it's very difficult. Not all of us can care for that loved one. Now, I don't know Mr. Blunt here. Is it Blunt? Blount. Yeah. I just want to say, please plan financially, because assisted living is $5-6 grand if you do have these diseases.
Right.
So having said that, you also mentioned research with Alzheimer's. Are there research studies that you know that would help pay for these tests, or all these tests individually cost, or when you get the test you get all of this information, and then, or do you elect some of that information and you know it, but maybe I don't want to know it?
Well, I think that's a really excellent question. Answering the question of Alzheimer's, I mean, now that we know that we're going to have possibly preventive treatments, cures, if you know that you have a loved one, you might want to consider getting genetic testing. Maybe you're going to go a different path in your life, but certainly in Orlando, starting right now, they're seeking out people who have especially double copies of the ApoE gene, and there is currently enrolling patients. It's going to be long-term to prevent the onset of Alzheimer's. In terms of the triangle, I think that's interesting because the more advanced the testing is, the more you can see of the triangle. Things like 23andMe, they're going to just do little tiny, what we call snippets. Usually it's ancestry, fun things, although they are looking for if you're carrying a recessive gene and things like that. But most of the time, when you get that portal, it's your portal. Most of the companies will say, here you are, here, kind of like here's your Facebook or your password, and you can determine who you want to share that with. Right now, I don't want to say that insurance is not coming, because in my standard blood work that I do when we do our executive physicals, I'm doing the aspirin genetics to know the aspirin dose. I'm looking at how somebody processes cholesterol. I'm measuring the ApoE genes. And it's funny, because now we know it's more, we're looking at it from Alzheimer's. When we started this 10, 12 years ago, we were looking at it for heart disease. So this thing is changing. And we may think a gene does something, but in the future find out that it really does this. I think it's important when you're looking at what type of testing, knowing how in depth you want to be. But also, I think since the information is changing, trying to find a company that actually is a living test. For instance, we use a number of, New Amsterdam is one of the more expensive tests, but it's fun because actually if it finds that we've got this new piece of genetic data that applies to a patient, I actually get the data coming to me now. So I can inform the patient that we now know that you're, this is what we're seeing. So it's quite interesting.
So can the actual test be done on any age of a person?
Any age. I mean, we're doing it on embryos.
True.
Right? We're doing it. Yeah, I'm getting my mom tested. She's incredible. She's 90. I'm like, what is keeping this lady going? I don't want some. I'm hoping I got some of that. Yes,
Mitchell Gordon, I'm a Medicare specialist. I work with seniors also. Very quickly, I saw one of the first stories of how they cured leukemia using HIV cells. And the man didn't respond, and then 2 weeks later he spiked to 106 temperature because he dumped 4 pounds of cancer cells. And he can never get leukemia again.
Wow.
My question, I'll preface it quickly with the reason. I was diagnosed with 1.2 million platelets, and my doctor gave me a normal diagnosis. So I dumped him. I found that I went to a hematologist who said, we can't do anything, take an extra aspirin. So I dumped him. And I went to another one who gave me some pills with no side effects, and I'm now down to 400,000. So I know you understand the difference.
Yeah.
My question is this. How do I know if I'm with a decent doctor or a good doctor? Because we can't all come to someone like you. We trust you now.
Oh, you can all come to me. Come on, I want to see everybody.
How do we also know that what they're telling us, their diagnosis, they're reading their analysis is correct? How can we tell?
I think the key is, especially when you have a problem like that, is you go to somebody who's a specialist in that field. Somebody who, this is what they do, every day. It's like, it's like if you're going to go get your car fixed, you're going to choose if who's best at tires, who's best at oil, who does transmission. So from a physician's standpoint, you want to have somebody who's very, very well trained in your particular problem. It's always nice also to have a primary care doc who's kind of right there to help you navigate this whole thing. If you have a good primary care physician, they kind of know, they've been in the community for a while, who's good at particular things. And that's what I do a lot. My clients, when I tend to get some clients who have complicated issues, but I do know, who do I need to bring in on the team. But what's going to be interesting is when you were talking about different drugs and things, the pharmacogenetics, based on how you process drugs, in the future, we put the drug in, and it says, this is the better medication for you. So I think that's going to be fun. That's going to be fun. Yes.
Dr. Harding, Ken Peach from the Health Council of East Central Florida. On a large scale, we're looking at close to 20% of our GDP now on healthcare. We're looking at the massive wave of baby boomers, 80 million, passing through over the period of a 16, I think, or 18-year period. And we're looking at a growing shortage of the number of physicians we have available in the future. How do you see this playing into the larger picture? Because my wife, as you know, cancer survivor numerous times, and had this genetics done for her matching on her chemo the last time.
Wow.
So the question is, going forward, how do you see this playing out? Is this something that's going to help save our system and enable us to do more for others by moving upstream? What's your thought on that?
Great question. My thought on that is we spend a lot of money towards the end. We spend a lot of money on you have the disease and now we're going to treat it. Even to do blood work and stuff, a lot of times you have to have a diagnosis to do a test. So imagine we change that paradigm and we go to being more preventive, more proactive, so that we're not going to be spending a lot of dollars towards the end of life. I think people are going to be healthier. I think we're going to be, if somebody's more prone to a disease with the gene editing techniques that we're seeing, we're going to be able to change the expression of these genes and make us healthier. I just see positive, across the board. It's going to be interesting to see how it plays out. But I think if we have a healthier, older population, we're going to be spending a lot less money on treating a disease. I mean, in my practice, I'm always preaching prevention, 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 using the latest technology, because that's the way to do it. If you let something go on your car, your house, if it's been there for a while, it's a lot harder to take care of. So I actually see this, an explosion to actually keep us healthier, less dollars towards the end of life. Thanks.
Thank you. Good morning. Rick Castro with TaylorWorks. As the child of a parent that we lost to Alzheimer's, the mere thought of knowing is beyond scared to death. I read all the research, and there's a lot of things that you can do, et cetera, but it just seems still to me that all you're doing, you can't escape the inevitable. So I'm just interested in what your comments would be about the fact that Alzheimer's is still the great unknown, even with all the things we know now.
Well, I think I would say maybe look at it. Another way to look at that would be say, and I just went through this with another patient, very, very scared of a particular disease the cancer actually, that ran through the family. And, always a fear, and finally, just decided that let's just test. Do I carry the gene or do I not? It doesn't, and the blessing was, doesn't carry the gene. So how wonderful is that, to take that, that weight off your chest, that you don't carry that gene. Now the opposite side of that is, I think if, you know, myself, I know because I've done all my testing, but if I had that gene, I would be focusing a lot of my efforts on everything that I can do to prevent, you know, the expression of that. For instance, healthy diet, healthy exercise, but there's things like some of the new diabetes drugs. Bydureon is one of them. Is a lot of stuff coming out on that, on preventing Alzheimer's and slowing that. Aspirin. Keeping your, you know, cholesterol is, in my world, just a total cholesterol, LDL, HDL, which most of you probably had done, is almost obsolete medicine. I'm actually looking at it now from a molecular standpoint. We look at what your cholesterol molecules look like. If you have like small little grains of cholesterol, they easily go into the blood vessels. Well, that's going to cause more what we call the vascular. You know, your brain is the most important thing. So if you're getting blockages in the blood vessels, and you, God forbid, have the Alzheimer's gene, that makes it even worse. So there's things that you can move around. Diabetes is huge. Diabetes, if your insulin levels are high, it's not just looking at your sugar, but if you're running high insulin, you're aging a lot quicker, and that ages the brain a lot faster. So I would say, from my standpoint, I'm always up for, you know, being more proactive. And, you know, as I said, they've got that new, you know, it's not just Orlando. There's a lot of studies going on Alzheimer's. So I think I'm fast forwarding, thinking I'm excited with what we're going to be able to do and prevent this, because I understand what you're talking about. I mean, in the past it was like, oh my goodness, but now I think we're going to see more and more treatments and things focusing on preventing that disease from happening.
Excuse me, Dr. Harding, it is a great presentation. I remember last year reading from Wall Street 24 about NATO's preparation that in the year 2050, there's going to be between 1.2 to 1.5 million centenarians on Earth. And that's going to change everything from retirement planning to healthcare costs to geriatric medicine, everything. And in fact, today, living somewhere on the Earth, there's supposed to be a human or two that will live to be 150 years old.
Put me there.
So, yeah. So my thought process goes to, let's say we come and we have the full genetic testing done, and you're able to give us key deliverables that help us lead a better life. But for some reason, we're beyond your reach when something occurs and we're hospitalized or have to go in for treatment. You're an early adopter of this. What about the average physician out there that might be treating somebody who's had testing done? Even if the medical records are available, will they know how to read it and treat it accordingly?
You're talking about reading the genetic data. Well, I mean, it's a challenge. I mean, I've been just learning. I mean, medicine is a challenge. It's a science, but it's also an art, and it's how much, you know, do you put into it. But in terms of the panels are kind of, they're getting almost hopefully dumb-proof. I mean, you know, here's the gene. The patient has one or two copies, and then I can push it, and all the research papers pop up under it. And here's our actionable things that you can do. So I'm hoping that it's going to make it a lot easier for to use the data and understand the data. There's going to be a learning curve. I mean, I think about when we, you know, all these electronics, when we brought in electronic medical records and we're on the hospital and we're all there trying to figure out how to make this thing work that now I do like this. It's a learning curve. And I'm sure there will be classes in how you do it and how you implement different things. But the good news is, I think if we implement this type of testing and this technology earlier, hopefully you can have less sick people on this planet.
We've got a couple more questions, and then we'll have to wrap up.
Mine's real quick. I'm Dana.
Hey.
You get this information, and everything's real exciting, but my question is, what's the level of accuracy where you said, what's your family history? And I'm like, well, no one's died of cancer. No one's had a heart attack.
Right.
Everybody either gets drunk or gets hit by a bus, right? So that's sort of my family history. No one seems to die of anything. They're all 100 years old, right?
That's good for you.
Good for me. But what's the level of accuracy for someone like me who comes in your office and goes, I got no problems, this is that, and then you pull up the sheet and you're like, no, actually, Like, what is that? What's the level of accuracy from the person like me who's like, I know my family history, it's all good, compared to, yeah, check this out, buddy.
It's very accurate. There's a lot of safeguards looking at, you know, especially the tests that you're getting out there, you know, just the 23andMe or some of the ones that you can order on, you know, on your own ancestry. There's a lot of regulations looking at that, making sure it's very, very accurate. But to your question, though, remember what I said. This is an evolving science. So what we think one gene may do, we may find out that it does something differently. You don't know what's going on in your body unless you've looked. Preventive medicine, when patients come to see me, we do very extensive, not everybody does genetic testing. I mean, you know, when people come into my office, even though we have certain little tidbits of that, but that's part of the normal physical in my office. You know, we're looking at the cholesterol from a molecular standpoint. We're looking for things to keep you as healthy as possible. You know, I can't keep you from getting hit by a truck or something, but I surely can use the latest technology to make sure that, you know, you're not at risk of having a heart attack or stroke or early dementia because your cholesterol is too high, or you're running pre-diabetes, or, you know, something as simple as B12. There's something called homocysteine, common genetic problem, where you don't take your simple B12 and methylate it so it crosses the blood-brain barrier. It's actually one of those things that we're looking at in terms of slowing down the memory. We know that people who have lower homocysteine levels tend to think better a lot longer. So if you had that, and that would come up on a regular blood test, what do? We just give you, instead of just plain old B12, you take methylated B12, methylated folic acid, eliminates the problem. So I think, you know, knowledge is power, and you decide, you know, what all you want to see. But going in and getting a really great physical with extensive blood work, that you can make changes that will affect how you age. Remember I said we, you know, have those things on the end of the DNA, the telomeres. So think of them like little BBs in a row. Every time a cell dies, you lose one of those guys. When it gets down to zero, the DNA unravels, and that's really when aging hits a wall. And we see it in different areas in the body. You know, people, when your hair starts turning gray, that's because, you know, you've lost that telomere. But you know, anything that you can do to protect those telomeres is very, very important. So I think it's just being more proactive. But anti-aging is slowing down that aging process by things you can fix, your micronutrients in your body, your type of exercise, because you only lose one of those little BBs when the cell dies and you have to turn over. So anything that keeps the cell alive longer extends your healthy lifespan.
Apparently, Mr. Dr. Harding wanted to put a word in here too, so.
Hi, everybody. I'm the other half. We've been married 42 years, and we've been working together for 30. And I just wanted to make a comment. I've been listening to the comments on Alzheimer's, and I think there's a point that really is important. What is true for your parents is probably not going to be true when you grow up 20 years from now. The movement is so fast, and the example is just in the last couple of weeks. Bydureon, good diabetic pill. It's been proven in mice now to reduce the plaque of Alzheimer's. It's the first potential new Alzheimer's drug in 15 years. We don't know that it's inevitable, even if you carry the gene. So I really want to emphasize, if you find this out, even if you do, just like the alpha-1 antitrypsin thing, you don't smoke, obviously, because you know your emphysema is going to come. Well, there's certain things you can do with Alzheimer's, even if you've got the gene, that will help you protect against getting it sooner rather than later. Now, if the drugs come into play, wow. And there's a very good chance that in the next few years, we're going to develop ways to do gene editing to take away the risk. So don't give up too early. And there's hope for everybody on this thing. That's my point. And the other thing I wanted to say is that somebody was asking about the what you do with your doctor, how you take this back. But we hope, one of our goals in our practice here is that we can keep an ongoing relationship so that we're helping with that. We can help primary care doctors, or we can be the primary care doctors. But the key on this thing is to have knowledge. If you have that, it's great. By the way, you did a great talk. Thank you.
I think I'm going to have to wrap it up.
Thank you.
One of the things that everyone can do is we have a LinkedIn closed group, so feel free to answer any questions there, and we can kind of keep the conversation going.
If anybody has any more questions between me and my husband,
but we want to be
happy
respectful of everyone's time to get you out here. Thank you so much for coming.